So in theater, there is a machine that can never ever think of missing when you are in theater. And this is this anesthetic machine. It depends. But for us here, we have this machine and it's a lovely one. I love it. This is the one that reduces a lot of work and hectic work and monitors the patient, how he's doing. It has a lot of cabinets and with full of everything. So my duty as a theater technologist is to make sure it is equipped with gloves for the anesthetist, with enough halothane. If the doctor or rather the anesthetist want to use isoflurane, we make sure it is full of the two canisters. Secondly, we make sure it is full with all the gadgets that are needed. These are masks to be connected to the airway, and all these are a combination that all goes to the patient after connection. So my duty also is to make sure that there is enough oxygen, there is enough nitrous and air, because there are several kinds of procedures that use different kinds of these gases. So my duty as a technologist is to make sure all these things are provided so that the anesthetist and the patients are all taken care of nicely. So in the cabinets, we have several of things. These are blades, and these blades are placed on this. They are called laryngoscope. And when the patient wants maybe for intubation, this is what they use. And it's very soft and fluent for the anesthetist to operate, or rather to put the patient to sleep. Several cabinets with all the things that the anesthetist would need. That is a nosopron. We have a mask. We have an ambu bag. Just in case we would want to bag the patient. But remember, the whole of this system has a system where we can get oxygen even through the system and through the ambu bag. It's called an ambu bag. So it's very important to be here. At the same point, we have this as an ETT, and this ETT is mainly used for patient again. And so this bag, this set is, the machine accumulates or rather picks up every other thing that is required with the anesthetist. So here, my work, when I come in and there is a procedure we are expecting, we make sure the airway and the swivel hand is very much handy, so that the anesthetist connects this into the connector, and then this goes back to the mask. So this mask goes to the patient. And you see, when all this is done, my work is to make sure I provide every item for the anesthetist for easier work, for easier flow. And that has been very good plus to our community. And so with all this machine and all these sophisticated issues here, they are all for the betterment of the patient that we are working on. Not only do we do surgery procedures, we also take pride in offering top-notch services, ranging from antenatal care, postnatal care. We have a beautiful and a very serene place known as a maternity, not forgetting gynecological services, above all, general services, and many, many more.
Janice Medical and Cancer Hospital is here to offer you quality health services. Services offered at the specialist clinic are obstetrics and gynecology, urology, pediatrics, laboratory services, antenatal and postnatal care, ultrasound, chemotherapy, among other services. Janice Hospital. We are located in Ngumo, Sunview Estate, opposite Kenyatta Market. Call us on 0714 734 343. Janice Hospital. Quality health care.